Hi, my name is Michelle Mooney. I am a registered nurse and I am completing my Master of Science in Nursing with a specialization in nursing education at Excelsior College. This is my capstone project, Which Patient Gets the Pillow? A look at implicit bias and its role in healthcare disparities. Implicit bias, also referred to as unconscious or subconscious bias, references attitudes, stereotypes, and prejudices, both positive and negative, that are held by everyone that influence their behavior and decision making. Implicit biases occur without the individual being aware of them. First developed in humans as a survival mechanism, spontaneous categorization of people based on their characteristics helped to distinguish threats from non-threats. Once formulated, this information is accessed in the future to assist us in interpreting people, behavior, or situations. However, these interpretations are not always accurate. The information we draw from our past categorizations affects our everyday interactions. These learned biases govern the majority of our social behavior and are very hard to change. Since everyone has implicit bias, what does this mean for our interpersonal interactions? Well, as humans, the way we process information about past experiences can result in inadvertent disconnect between the healthcare team members' egalitarian goals and the effect of their implicit bias on clinical decisions. This can affect patient care outcomes in a positive or negative way. For example, patients who elicit feelings of pride and admiration, such as heterosexual middle-class whites, tend to receive more comprehensive, effective treatment. A patient who elicits the subconscious response of disgust or disdain, such as an individual who is homeless or has a substance abuse problem, may result in the healthcare team member avoiding or minimizing interactions with that patient. Patients may perceive a healthcare team member's implicit bias during an encounter and interpret it to mean that the healthcare team member is apathetic to their health concerns. This cultivates a lack of trust, which can keep patients from adhering to the prescribed treatment plan. This dynamic can lead to discrimination and eventually disparities in overall care. Healthcare team members of all disciplines need to be aware of implicit bias, and more importantly, should have required education on what they can do to minimize its effects on the care that they give. Awareness is not enough to fight it. The paradox of bias awareness and attempts to suppress it can actually lead to the activation of stereotypes and prejudices. The consequences of implicit bias are far-reaching, leading to breakdown in patient-centered care, and they occur without the awareness of the healthcare team. Since implicit bias can contribute to health disparities, let's define what health disparities are. They originate from favoring certain traits or characteristics over others, such as race, ethnicity, religious preference, socioeconomic status, or sexual orientation. The result is unequal treatment of these populations, leading to patients who are sicker than they would have been had they received care at the level of primary or secondary prevention. This is evidenced by variations in morbidity and mortality rates. Primary care is care aimed at the prevention of a disease process. Secondary care is aimed at early disease detection and treatment before a patient becomes symptomatic. Tertiary prevention is directed at attempting to halt further disease progression. Patients who require tertiary care have increased morbidity, place a financial demand on the system, and have potentially avoidable mortality due to their illnesses. The main stakeholders in this project are the patients. A literature review to attempt to identify the population most affected by implicit bias has revealed that implicit bias exists for race, ethnicity, weight, gender, age, education level, health insurance coverage, health literacy, past medical history, sexual orientation, and disability. Behaviors that are socially undesirable, such as substance abuse, may be prone to implicit bias as well. Healthcare team members are also stakeholders. Most people who are in helping or service professions like to see themselves as free from bias. Most hold egalitarianism as a professional value and feel that they treat all patients the same. This does not mean that there may not be some healthcare team members that hold explicit bias, but they are not the focus of this project. Implicit bias in patient encounters can result in more people who require tertiary care. This places increased stress on the patients themselves, their families, caregivers, resources in the community, and the healthcare organization as a whole. Faculty and institutions that provide education to healthcare team members are stakeholders. It has been hypothesized that healthcare education may play a role in implicit bias. Healthcare team members learn about risk factors, such as ethnicity or other social determinants of health, as they are associated with certain diseases. This may later manifest as a stereotype without the learner being aware. Other stakeholders include commercial and government insurances, employers, and society in general. All of these stakeholders bear the increased expense of caring for those who have advanced morbidity and mortality as a result of healthcare disparities. These costs encompass direct medical care, indirect costs like loss of productivity, and premature death. It was estimated that eliminating health disparities for minorities in the United States would have decreased the cost of direct medical care by $230 million and the indirect cost by $1 trillion in the years 2003 to 2006. These statistics do an excellent job of showing the overarching financial impact that healthcare disparities have on society. We cannot control the implicit bias of those around us. As healthcare team members and stakeholders, we can acknowledge it and take steps to eliminate it from our practice. Educational institutions, healthcare organizations, community organizations, and payers can take a look at evidence on this concept and incorporate it as part of their curriculum or ongoing staff development. Healthcare team members have a responsibility as an industry that serves the public to provide patients with equal quality of care. Integral to providing education on the concept of implicit bias is the adult learning theory. To effectively receive education on implicit bias, the presentation was created keeping the assumptions of adult learners in mind. Adult learners need to know the reason why they need to learn about something. They are self-motivated and have a wealth of experience that they can draw from to enhance their learning. Real-world problems encountered by adults foster a readiness to learn and a desire to immediately apply that knowledge. Adults are internally motivated to solve current problems. John Rawls' theory of social justice supports the need to identify and mitigate implicit bias. He wanted to delineate what makes society fair and ethical. He proposed that everyone in society should have the same fundamental rights, and inequalities in society should be addressed to defend those who are in a lesser position. If the healthcare team is unwittingly creating disparities through their implicit bias, under the principle of social justice, they should engage in techniques to mitigate it to ensure that they are addressing any inequalities, as all patients have the right to receive the same quality of healthcare. Another theory that supports the need for a project on implicit bias is Madeline Leininger's culture care theory. Leininger proposes that care is the very basis of nursing and is crucial for a therapeutic relationship with a patient. To care for the whole patient, the nurse must engage in not only a holistic assessment of that patient, but an assessment of themselves to determine how their own culture will affect their ability to care for those who have culturally diverse backgrounds. Although specifically written for nursing, this theory applies to the entire healthcare team in caring for an increasingly diverse population. The vast majority of healthcare professionals do not intend to treat patients differently, much less create healthcare disparities. Implicit bias is alarming because its result is unconscious discrimination. There are strategies to mitigate implicit bias, but first it must be identified. The implicit association test, or IAT, is a valid tool for predicting behavior outside of our conscious awareness. The IAT is computerized and, per Project Implicit's website, measures the strength of associations between concepts such as black people or gay people, and evaluations like good or bad, or stereotypes such as athletic or clumsy. The main idea is that making a response is easier when closely related items share the same response key. Most people who take the IAT will have implicit bias in one or more of the areas. A web quest was selected to deliver instruction on the concept of implicit bias. It provides flexibility and asynchronous learning, where the learner is not required to be present at a specific location or time. The web quest would be appropriate for not only healthcare students, but for staff development of interdisciplinary healthcare team members. It could be used as an independent learning module or as part of a flipped classroom, where preparation is done prior to class, and the time in class is utilized for discussion or application of that material, such as role play. The web quest instructs on the concept of implicit bias and provides a link for the learner to take the IAT. Education on various mitigation strategies such as perspective taking, developing a shared identity, making patients partners in their care, being mindful, exposing oneself to images and experiences that are not stereotypical, such as women as leaders, engaging in self-care, and making positive goal attainment a habit. It provides links to these mitigation strategies via a slideshow, video, infographics, an article, and a Powtoon to address various learning styles. Multiple additional links are provided for those who want to learn more about the concept. Evaluation is performed using an essay question and multiple choice quiz. Equal care, not colored by implicit bias, is crucial to maintaining optimal health and patient care outcomes and preventing healthcare disparities. This project was not developed with a specific component or discipline of the healthcare system in mind. It applies to the healthcare system as a whole. The healthcare system is made up of people, educational institutions, organizations, insurances, and the resources utilized in the provision of healthcare. There are individual organizations that make up the healthcare system, but they do not function independently. Having a culture of safety in healthcare organizations requires the commitment and collaboration of multiple disciplines to pursue solutions to patient safety concerns. A culture of safety is of the utmost importance in every patient encounter. Outcomes. Outcome 1. Interdisciplinary healthcare professions will acknowledge their own implicit bias. Learners were asked to discuss their feelings about the IAT results, their concerns about validity, and what the results meant to them in their healthcare practice in an essay question. They were not asked to disclose their results to the IAT. This outcome was met as evidenced by 100% of learners acknowledging their reactions to the IAT and what it meant to their practice. Outcome 2. Interdisciplinary healthcare professionals will examine the effects of implicit bias in patient care. Learners were asked to answer 10 quiz questions, which included questions regarding how implicit bias affects patient care. This outcome was met as evidenced by 100% of learners receiving grades of 100% on the quiz. Outcome 3. Interdisciplinary healthcare professionals will analyze various methods to mitigate implicit bias. Learners were asked to read a case scenario about an encounter with a patient, a nurse, and a provider. They were then asked to answer a second essay question providing 3 mitigation strategies and examples of those strategies that could have been used by the healthcare team member to mitigate implicit bias. This outcome was met as evidenced by 100% of learners able to name 3 mitigation techniques that could have been used in the patient care scenario. Outcome 4. Interdisciplinary healthcare professionals will employ evidence-based strategies to reduce the incidence of implicit bias. Using the answers to the second essay question, This outcome was met as evidenced by 100% of learners able to give examples of each of the 3 techniques they named to mitigate implicit bias. The Institute of Medicine, in their 2002 report on equal treatment, has acknowledged the effects of healthcare team members' prejudices and stereotypes, conscious or unconscious, on patient outcomes. Their report states that based on data extracted from patient charts, when all other variables were the same, minorities are less likely than whites to receive needed services or procedures. This is a big problem. Almost every value and standard we uphold ourselves to as nurses points us in the direction of needing to remedy implicit bias. As healthcare team members, we have a responsibility to attempt to eliminate all factors that interfere with the goal of equal care. Improving care through education on the concept of implicit bias can have a ripple effect, and intervention is needed to reverse the far-reaching, even global consequences as our world becomes smaller and increases in diversity. The master's prepared nurse needs to embrace all the standards and values that contribute to their profession. The master's prepared nurse is a leader, and as such, they should use their advanced education to better their profession. The master's prepared nurse should apply evidence-based practice and theories to their nursing practice to promote quality patient care. They need to lead by example and embrace the continuously changing environment of healthcare. Once aware of the emerging literature and evidence on the concept of implicit bias, I felt a responsibility as a master's prepared nurse to employ my leadership skills to address this concept in the education of not only the nurses, but the entire healthcare team. After learning about the concept of implicit bias, I analyzed its effects and potential impact on a culture of patient safety and fairness, utilized research and evidence to promote education about the topic and that culture. This is driven by the values listed in the American Nurses Association Code of Ethics for Nurses: respect, fairness, and caring to promote health. I have grown as a master's prepared nurse as a result of this project. I have confronted my own implicit biases, and I have filled my toolbox with mitigation strategies. I hope that others who receive this education will fill a gap in their knowledge and change their practice because of it. As master's prepared nurses, we must maintain a spirit of inquiry and a commitment to lifelong learning. We can never stop questioning how we can do things better, where the knowledge gaps are, and what we can do to close them. This thinking benefits the patients, the profession of nursing, other healthcare team members, and the organization as a whole. The ultimate goal of implicit bias education is to effect change in healthcare team members, making them mindful of what they think, what they do, and how they are perceived, which will lead to better care for all. Thank you.